you want to be healthy and you think taking care of your body will do the trick, well, actually, it turns out it's not really enough. But this is not to discourage you. Stick around to understand how to really be healthy, and honestly, it might surprise you. This is part 2 of this episode, so go check out part 1 to understand what I'm talking about here, and then come back for the solutions.
Healing is so built on relationship, right? This is why placebos work, or different kind of rituals or ceremonies often work in certain cultures. And that's why this wellness industry has turned into a multi-trillion-dollar industry across the globe, is because people are not getting that from their doctors.
Let my breath brush your ears. Inhale these words. May they fill your lungs and the atmosphere.
When we think about health, we think about what happens within the body, at least in Western and Westernized societies. And that's fair, because that's where we perceive ourselves as healthy or unhealthy. But it is a bit more complex than that. So to understand that complexity, I'm speaking with Dr. Wendy Johnson, author of a book called Kinship Medicine, who will share her perspective as a family physician and public health professor. But for now, I cannot do an episode about health without ranting about doctors. A lot of times, doctors dismiss my and just our concerns in general, and won't even take like more than 5 minutes to listen to a patient. Now, I guess it's because of the business model of being a doctor, and it's not like the doctor's fault per se, but I personally almost always feel upset after leaving the doctor's office. And a lot of times I get either nothing out of it or pills that in no way, shape or form address the root causes of my symptoms. And I feel like I did my best to care for my health, because I'm not a doctor, I'm not a scientist, I don't know what else to do, but to trust the doctor. And ultimately, the doctor didn't give me the help that I really feel I needed. And I've only been to the doctor in countries with universal healthcare, so I can't even imagine the stress I would feel on top of that if getting sick could potentially bankrupt me.
Yeah.
And a very perverse consequence of this, what I perceive as a lack of dedication from these doctors, is that it leads a lot of people to resort to all kinds of therapies, diets, and supplements, mostly which they find online, and which might totally work and be legitimate, but have also turned into this huge, sometimes baseless industry and belief system that can become detrimental when it leads to wellness fatigue, or worse, when it delays important diagnoses. And I know I've turned to these alternatives, and I'll probably keep doing it. And we turn to them because it's supposed to be more holistic, which makes so much sense given everything you just explained, that our bodies and minds are affected by so many external factors. But it seems these practices, when filtered through our individualistic and productivity and performance-focused cultures, they tend to become this very unholistic thing, this completely atomized view of wellness where you're in charge of your own wellness and of doing the research to find the most efficient therapy, diet, workout routine, or supplement for you, even though you have no background to understand how any of it works, by the way. But it is your responsibility alone. And again, I do think there are interesting things in this realm of alternative medicine. It can be super helpful, especially in a system where regular doctors can be bothered to investigate root causes, or just can't because of the system. But still, I can't help but think it would be even better if doctors were more open, sympathetic, and supportive, and actually guided patients towards wellness instead of often leaving them feeling unheard and maybe more supported by the wrong kind of wellness influencer. Because this lack of dedication I see in many doctors doesn't help build trust in the collective system that they are the face of. So I know this was a long rant.
It's a good rant. It was really, really well and articulately stated.
Okay, great. I was afraid maybe it was too intense.
No,
but yeah,
I
needed to get it off my chest.
Yeah,
and I wanted to ask you: do you think, as a doctor yourself, do you think there's a solution to this? Can doctors have more time for their patients and also better social skills. And of course, I'm talking about regular doctors here, not just the boutique ones that almost nobody can afford anyway, the ones you mentioned in your book.
Yeah. Well, yes, I think we need to advocate together for a whole change in the Western healthcare model. So part of it is because it's profit driven, but as you said, even in countries with universal access to care, there is this problem that you have a 5 or 10-minute visit. The doctor is trained, not like, I talked about that 20% of your health that's biologically determined and the other 80%. The doctor is trained in that 20%. So when you start talking about the 80%, the doctor gets really nervous also, because the doctor is being held to a standard where they have to see 20, 25 patients a day. They're going to get disciplined if they don't do that. They're going to maybe lose their job. And so they try very hard to steer you back to that 20% or just cut it off, because they're not trained to do that. They're not trained to be able to respond to that other 80%. This is also killing doctors. That's the other thing. Burnout and stress among doctors is sky high because we're under so much stress. And when we have a chance to connect to patients, to really build relationships with patients, that is also very rewarding for us as doctors. And so if we could change the system, so as you say, number one, that doctors were trained in how to listen to patients, trained in how they could help patients with that other 80%. And also, it doesn't have to be just doctors. We should have teams of people in our medical system that, there's a lot of critique. Oh, doctors don't learn about nutrition. Well, okay, it would be nice to learn more about nutrition, but there's like a whole field of people that just do nutrition. They're called nutritionists and dietitians. And so why can't, just like I would refer you to an orthopedic surgeon if you broke your bone, if you have a illness that is really affected by your diet, why can't I have working in my office with me a nutritionist that you can talk to, with me or apart from me? I don't have to do it all as a doctor. In fact, it's ridiculous to think I would, but I should be the person that's like the conductor of the orchestra. But in order to do that, like you said, I need to have time to create relationships with patients. I need to have time to really understand the root causes of their disease as they understand them, not as my textbooks told me I need to, see them. And I need to meet them where they are and help them with their illnesses with using my expertise, but also leveraging the expertise of all these other professionals, including behavioral health, nutrition, health education, health coaching. We're not trained in listening. We're not trained in motivational interviewing. We're not really trained at social determinants of health and how much they affect our overall health. And I say this, obviously my training has changed in the last 30 years, but not really that significantly to shift the balance to that other 80%. And there's so many people that feel the way you feel. And I think that's really fueling this backlash against the healthcare system and the public health system, the backlash that we saw during the COVID pandemic. I really do understand it when people get skeptical of Western medicine, because in many ways they've been treated really badly in the healthcare system.
Mm-hmm.
And
And also, one thing that I feel Western medicine does very poorly is prevention. Like, if I want to have an appointment and just talk about prevention, I only have access to my regular doctor. If I want prevention regarding nutrition, like how to prevent illnesses through nutrition, or taking care of my skin, or taking care of like whatever organ, I can't, because I can, but I have to pay out of pocket, because my doctor will only refer me to this specialist if I have an illness or at least a symptom that that indicates that I might need treatment or something like that. And I do not understand, like,
Right.
I really don't understand why we don't have access to specialists unless we're rich and can just pay out of pocket.
Well, in some cases, I think what you want is not even a medical specialist, but like you said, a nutritionist or somebody who, for example, if you have an injury, right? There's this orthopedic surgeon that can fix it with surgery. But what about a personal trainer that can help you specifically with those areas of your body that, and where those muscles are and knows how, or a massage therapist or an acupuncturist or integrating other kinds of medical modalities outside of Western medicine that might be better at treating that specific thing than Western medicine is. Because again, I think what you're talking about is in the realm of that 80% that we ignore in Western medicine. And when you start talking about specialists, you're even getting a tinier little slice of that 20%. And I think really we need to think about opening our idea of what healthcare means. If I write another book, which I might, it will be that. It will be reimagining healthcare. Like, what if we tore the whole thing down and rebuilt it from scratch based on what you're talking about, your experience, based on what healing really works for people? And healing is so built on relationship, right? This is why placebos work, or different kind of rituals or ceremonies often work in certain cultures. So it's not, if I give you a sugar pill and it works to alleviate some symptom of yours, it doesn't work because of the sugar pill. It works because you trust the person who gave it to you and you feel that they have your best interests at heart. And that's why this wellness industry has turned into a multi-trillion-dollar industry across the globe, is because people are not getting that from their doctors, because their doctors are overwhelmed and have 5 minutes and are going on a script where they have to just deal with certain things. And if you talk about other things, they ignore you or change the subject. And they're seeking those kinds of relationships from other kinds of providers. And sometimes that's good, like you said, and sometimes that's just, they're just taking your money. And so how could we structure the healthcare system so it could be trusted, so it could be somewhere where you could build those relationships with people, so you could have a whole team of different people that are really good in their modality, and you could access the kinds of things that you need. I'd like to imagine that.
And she started doing that. She was actually part of a team that created several innovative programs at a health center in New Mexico in the US to address some of the external factors of health that we talked about in part 1. One of these programs allowed people who were struggling with nutrition and weight not only to be screened for health problems, but also, and that's the cool part, to access cooking classes, group visits to farmers markets, group hikes, and weekly baskets of cheap, healthy foods. But notice I'm using the past tense here. That's because Wendy told me the program had to close due to a lack of funding. And that's the real issue, money. But I wonder who's doing the math, because prevention is notoriously cheaper for patients and governments than a lot of treatments. So yeah, whoever's doing the math, you gotta do better. Now, I want you to see the poetry in this very political thing that is health. So whenever you need a reminder that your body is an ecosystem within an ecosystem, think about the fact that the water in your body evaporates and might at any given moment be in a cloud above somebody else's head across the world. That's what my song Your Cloud is all about, so here's a snippet. And you will find the full song at the end of the episode or on your favorite music platform.
There's a cloud high above me. Some might spurn the shape of a bee, but distant sweat is all I see. Spilled by a little boy running from balls, by lovers' bodies touch, legs, bellies, chests, and paws.
Now, going back to the purity aspect that I mentioned when I quoted Sophie Strand in part 1, what if being healthy wasn't the end-all be-all? hear me out. I'm not suggesting it's not important. As someone who sometimes struggles with hypochondria, trust me when I say I understand how important it is to feel safe in your own body. But you know what? Let me just quote Sophie Strand's "The body is a doorway" again. She was going to be on the show to express her own ideas much more eloquently than I can, but sadly she couldn't make it, so here goes. Evolutionary biologist Lynn Margulis popularized the endosymbiotic theory, demonstrating that the complex cells that build our bodies are likely the product of an ancient symbiotic fusion between simple bacteria. She repeatedly characterizes the different stages of eukaryotic cell development as a failure to digest. What a wild thing to realize, that our bodies were produced by the incomplete cannibalism of ancient microbes. One bacterium's indigestion literally changed the face of the world. New life grows from failure. Bodies become possible because some other being's body failed to behave correctly. I found this comforting as I realized that I wasn't going to heal quickly or easily. Had those first hungry bacteria properly metabolized the other bacteria, nothing new would have been born. The emergence of new life depended on a mistake, an inability to complete a task. Then later in the book, she adds, I want to suggest that we are all haunted, not by flashbacks and memories, but by an imaginary idea of wholeness, by the idea that there is a normal body that renders our body deviant, that there is another version of us, a healthy version, that we must spend our every waking hour, our hard-earned money, our dedicated spiritual and physical focus, striving towards this other us. We do not bring in priests to exorcise this ghost. Instead, we make it our Holy Spirit. We sacrifice our lives, our time, our money, and our attention at the altar of a body that never existed. So like I said, I'm not suggesting being healthy is not important, and I definitely don't think this is Sophie's point either. I'm just receptive to the idea that, our bodies are essentially renewed every few years as nutrients that come from the outside are metabolized by bacteria and organisms that live in and on us but don't share our DNA. So we're really not as autonomous and siloed as we think we are. So when we perceive ourselves as sick or unhealthy, maybe that's actually in service to the overall ecosystem or garden that is our body. And maybe that doesn't have to keep us from leading good lives, and we can take the endless search for purity out of it to have a wider and wilder vision of what health even is, to make it more collective and include more scales. But we're not there culturally, and we might never get there. And again, as with most things, I have no issue with individuals doing things just for themselves. But for me, it's about asking what culture we want to promote on a collective level. And that's why I'm doing this episode, because I know I want a culture that promotes health for as many people as possible. And currently, we're collectively doing the opposite, enabling political leaders and representatives to undo protections without offering any alternative to keep people safe. Protections that were never even sufficient in the first place. And if you're thinking, not me, I don't care, I don't want those protections, I respect your impulse to contradict me, but I just can't believe that anyone would prefer chronic danger over general peace of mind. Remember, humans need to feel safe. Sadly, in this context, I may get the best supplement or the best tailor-made health protocol, but I will still be going against the current, because the current is taking us towards less and less healthy societies, making us less and less free to enjoy life and make plans for the future. So given everything we heard in this 2-part episode, my suggestion is that we keep doing whatever helps us feel better individually, and at the very same time, we strive to build a better system that aims to reduce the chronic stressors that are so detrimental to everyone's health, with things like better public policies on urban planning, transportation infrastructure, work hours and management, community centers with accessible programming for everyone, community gardens, green spaces you can walk to, intergenerational spaces, better regulations on food ingredients, because how are there still scandals in the food industry? Healthcare that actually centers health and not so much money, science-based parental leave policies, and many more. In other words, a system we can all benefit from instead of each of us taking our own personal pills and meditation retreats if we can afford it. Now, I don't know what that system should look like and how it should be funded exactly. And maybe the perfect system doesn't even exist. But I think we can look at existing systems and see what is yielding good public health results. For example, if where you live, a big part of the population doesn't have access to important treatments and preventive services, maybe that's a red flag. And if most people have access to green spaces and healthy food, air, and water, I guess you're doing something right. So let's build a system that doesn't try to pretend we're not part of something way bigger than us. One that reflects the fact that we depend on what we perceive as the outside, these external factors that have very little to do with our individual genes. Okay, now it's movie time. If you want to watch a movie about how the outside can make us sick and the inside, I recommend the French movie Goliath, so Goliath, with Pierre Ninet, or the Argentinian movie Axiomas. And if you only watch movies in English, there's Dark Waters or even the classic Erin Brockovich. If you have more movie recommendations about this topic, please do leave a comment. Before I leave you with some extra information and the song you heard today at the very end of the episode, let me quote the well-being scientist. We need to redefine the we in wellness. I hope you got some valuable insights from this episode, and if you want to learn more from my guests, you'll find everything you need in the show notes. I, for one, thank you for your attention. I know you could have been watching or listening to a billion other things, and I'm glad you picked this one. Now, 3 things before I leave you. Number 1, if you liked the music you heard today, you should look me up on the music platform you use. There will also be a link in the show notes to help you find me on there. Number 2, if you want to help me make the internet a place for more constructive and nuanced conversations, you can subscribe, like the episode, share it, and leave a comment or review depending on where you're listening to this. And number 3, you can also subscribe to my free Patreon, to my free newsletter Night Sky, and follow me on Instagram or TikTok to understand a bit better the messages behind my songs. Again, everything will be in the show notes. All right, thank you, and take care, and keep trying to make sense.
There's a cloud high above me. Some might spot the shape of a tree, but distant tears are all I see. Cried by a little boy in the ruins of a playground. That lover was lost the wing of it found. I don't know you, but I find you in the crowd. No, I don't know you, but I recognize the cloud. There's a cloud high above me. Some might spot the shape of a bee, but distant sweat is all I see.